Hello viewer, welcome to today's episode of Health Talk Show. Today we have beautiful guests in the house and we are going to discuss about anxiety. It is a moment in life which people need to understand themselves. I'm your host Lucy Wanza-Kariuki and I'm going to allow them to introduce themselves. To our guests, welcome to the show. Kindly introduce yourself from the farthest end.
Thank you. My name is Mercy Wambua. I'm a clinical psychologist and a trauma and debriefing specialist. I'm also a master's student at GVSIU and I'm glad to be here. Thank you.
Welcome so much.
Hello viewers, my name is Mercy Kibe. I'm a counseling psychologist from the Kenya Institute of Professional Counselors and I'm the co-founder of the Phoenix Hub, whereby we deal with mental wellness and leadership in high schools and primary schools. Thank you.
Thank you so much, Mercy, and welcome to the show.
Thank you.
Last week we were discussing about some different types of emotions.
Yes.
And today we are going to undertake another one, and I'm kindly going to invite Mercy. We have two Mercies in the house. Mercy Wambua, kindly introduce to us what we are going to discuss.
Okay, so today's topic is on anxiety. So anxiety is a disorder, mental health disorder, which has various other disorders under it. But generally, anxiety is a feeling of restlessness, persistent worry that it affects daily life. It affects functioning. So if you're in school, it will affect school performance. If you're at work, it will affect productivity. So it's the general state of being restless. That's what anxiety is.
Yes, thank you so much for that introduction. And restlessness. What do you mean? Is this person not settled? They feel like walking, sitting, or how?
So anxiety would display itself differently based on individuals.
Yes.
So there are those who have constant worry, they'll not be settled mentally, there's some persistent fear of the unknown, of the future. There are those who present with psychosomatic symptoms. So what psychosomatic symptoms refer to are the physical representations of a mental disorder. So sometimes someone with anxiety, they may start complaining of persistent stomach aches or headaches, or a child who is beyond the age of wetting their bed would start bedwetting, and that could be a reflection of anxiety. So depending on different individuals, it would present differently.
And
but
age.
Yes. So it's different. It's just it's in general. It's the persistent worry, the persistent not being settled, or restlessness, or just pacing around in a room because of. Although there's anxiety that doesn't progress to disorder, because anxiety is normal. If you're waiting to sit an exam, you could feel some form of anxiety. If you're waiting to walk into an interview, you could experience some anxiety. But when now it becomes that it affects your normal functioning in different spheres, and that becomes a disorder.
Yes.
Yes.
Predisposed to anxiety than others, and maybe you can tell us what are some of the causes.
Yes, there may be people who are more predisposed to anxiety.
Yes.
And as she said, it depends with the environment and the individual. And in most cases, I'll still repeat that anxiety is a normal feeling. Right now, even before we came to set, people are anxious and you're trying to remove steam. But there's also this anxiety comes with trauma. You may have undergone an experience that made you become anxious. And a good example is assuming you had an accident, a near-death experience.
Yes.
I mean, an accident that made you almost come to a point of losing your life. Through this trauma, you experience that every time you're trying to do something, that experience lives in you and creates you anxiety every time you're on the road driving, or you see someone almost being knocked by a car, or sometimes you're sleeping and they start that image starts replaying itself unconsciously in your brain through dreams. This can create that sense of chronic anxiety, which now becomes more prone, makes you more prone to being more anxious, and it can lead to depression, stress, and also it can lead you to being better functioning in your daily life. So in such cases where someone has had that experience that makes them go through a trauma that they have not dealt with, then they can be more prone to anxiety. And what we advise people is, if you have had that experience, it's good now you seek therapy. When you realize that your day-to-day life is being impaired by these memories or these panic attacks, then it's good you seek therapy so that you can be able to deal with that moment in time and also claim back your power.
Okay.
Yeah, because anxiety can take away your power.
Yes.
Yes.
Your self-esteem.
Your self-esteem, also your functioning. You realize that if you are so good in academics, now you are deteriorating. Performance at work, even relationship, because every time you're anxious and you're thinking, what will happen if I go to that gathering? Will people see me the same way? Now I have a scar, I have a limp, I'm not walking better. You become so tensed that even maintaining relationships becomes difficult, or because you're always anxious, not knowing what happens next, or overthinking, even I would say.
Yes.
Recreating scenarios, irrational thoughts that really don't make sense. And you're just seeing yourself as a failure because of anxiety.
Okay, thank you for that. And if I may ask, are there like types of anxiety or anxiety? Mercy.
Yeah, there are different types of anxiety. So there's what we'd call social anxiety. So social anxiety is the fear that things could go absolutely wrong when you're in a social gathering,
Yes.
or when you're in a public space, you know. So you feel like probably your emotions will go out of control and you do not know what to do, and then you become helpless. Then there's also phobias. Phobias are anxiety. So phobias is a persistent fear of, it could be anything. You've heard of people who have the phobia for heights, you know, phobia for large water bodies.
Waters.
Yeah, and when you look into it, you realize something could have happened, that, like she's saying, a traumatic event could have occurred. For instance, you could have had, so with post-traumatic stress, it could either be something you have experienced as a person firsthand, you have heard about it, that it happened to close people, you have witnessed it, or you have just been told that something happened to someone that was really close to you. So that is usually called vicarious trauma. So vicarious trauma is a trauma you experience based on another person's experience. You didn't go through it. So what happened is that, say for instance, you guys, like she's saying, you are in an accident, or for water, let's assume you guys were in a boat, and then the boat capsized, or you heard of family members, like for instance, people who live along the shores of Lake Victoria. That's a common occurrence. So maybe a family member died, and then so now anytime you think about, you know, it becomes like, I can't go into the water because now I fear that I will drown, you know. So these phobias, usually, there are phobias that are specific, or there are phobias that are just general.
Yes.
And then there's also panic disorder, panic attacks. So with panic, it's almost like you freeze. What happens is that your brain, to protect you, it freezes. So sometimes you have trembling, you can't breathe, you know, you cannot move. So that one is also dependent on, it's an extreme fear of something that leads you now to develop, either you can have one episode which is just referred to as a panic attack, but if they're consistent, then it's referred to as a panic disorder. So with anxiety is just a general umbrella term, but now there are different types of anxiety, and that one has to be diagnosed by a mental health professional, that is a psychologist or a psychiatrist. Yes.
Wow. Mercy, you talked of environment, and how it is one of the effects that can contribute to our status of the mind and the heart. If I may ask, how is environment influencing the way we live, and especially our mind?
The environment, we have a way of adapting to our environment.
Yes.
And last week we were talking about environments that can create anger and fear into you. What happens when you're talking about environment, when it comes to anxiety, it can create a mode of fight or flight. Fight in the sense that, assuming right now we are in that accident bit, or someone attacks you right now, the first thing that comes to your mind is either I fight or I flee. So the environment that you find yourself contributes largely on how you react in moments of anxiety. Let's go back to trauma and phobias. There's something we call systematic flooding.
Yes.
In this sense is when we are dealing like now with anxiety, if that particular place or environment, we can create the scenario that started making you experience these panic attacks or anxiety. When we recreate that environment, the environment then has that power to trigger back memories and feelings that you experienced before you began having this anxiety or panic attacks. So at large, an environment that triggers you, then I should be sensitive to know if I take Lucy to this environment, it will trigger those anxious behavior in her. But if I withdraw her from that environment, then I can create a calmness and a mode of relaxing between her. So environment really plays a very big role when you're dealing with clients who have anxiety disorders, because you either recreate that traumatic experience, or you withdraw them from that experience and you give them a better experience that they are able to relax and deal with what is happening. But in most cases, we don't advise you to take them back just at once to that environment where they experience the trauma, because then what happens again, you just expose them at once to that environment. They may go to panic attacks, stress, or even heart attack. There are people who just go in shock and they mute. So it's good, even when you're dealing with these clients, be very careful how you introduce that scenario that brought them to the state they are right now. And that's why we are saying it is a systematic way of approaching that past experience so that they can be able to overcome it.
Wow.
Yeah.
That's a very good explanation. And it makes me thinking and asking now if Mercy could take us through the importance of family system, because she has talked about the environment. And I feel and imagine that we are all from families where we have been brought up, where we are, how we are, sometimes the conflicting messages from the parents. Maybe you take us through the family system.
Okay, what I'd say is with mental health, it doesn't happen in a vacuum. So there's what we call nature nurture. So that's basically to talk about your genetics and the environment.
Yeah.
So sometimes with a mental health disorder, you could be genetically predisposed to it. So the environment that you're in dictates whether it will manifest or if you'll be protected from it.
Yes.
And in this case, environment is your family. So I'll give an example. There's a study that has been done, many twin studies have been done just to check how the environment affects an individual. So twins, twins genetically are almost the same, say identical twins. Yeah. So one twin would be put maybe in a family environment that is very calm, and another one would put in an environment that is very chaotic.
Yes.
Just to check and see how the genetics and environment they interplay. So with family, you find that, like she said, there are people who are more predisposed to getting anxiety disorders and the like. Yeah. Especially with things that are called adverse childhood experiences. So this could be from your parents. So you could be emotionally abused, you could be physically abused, you could be neglected by your parent, you could be coming from a house where there's intimate partner violence. So this type of children, because of the environment that they're in, they're more predisposed to what we call, they have poorer psychotic outcomes in future. So they're more prone to getting anxiety or depression or ending up using substance uses. So they end up in addictions. So environment, and in this sense families play a critical role in determining how a person will be in future. So sometimes children go through things that affect them in childhood, and then it could manifest immediately, it could manifest in adolescence, or it could manifest in adulthood. So just depending on whether we call them protective or risk factors. So protective factors are social support, when your parents are involved, if you have good relationships with your siblings, if probably your whatever religion, Hindu, Christian, if you guys are very inclined towards religion, that's a protective factor. Then risk factors, is one of your parent a drug abuser? Is one of your parent an emotional abuser? Are you in a home where it's so unstable? One day you guys are okay, the next time you're being kicked out of the house, or there's violence and all of that. So family systems really influence how some of these disorders manifest.
Yes.
And I think just to add on that, I love the explanation that she has given, and it was taking me back also to now coming to age as adults.
Yes.
Now that environment that you are brought in, sometimes you carry the environment even in marriage or in school or in workplace, because there's a way that you have been trained to do things at home. Now assuming the way she was talking about a volatile is a bit adverse, but an abusive family, an aggressive family, whereby there's chaos, there's fighting, there's this abuse, there's reproach, there's no confidence being built in a child. You find that these scenarios create an anxious child. Because every time when you did not get that approval back at home, you will always be anxious trying to get that approval wherever you go. And when you do not get that approval, then now you start replaying in your mind that this is how I have been brought up, this is how the environment should always be, and you become a carrier of that generation if you're not able to create that change. And if you find the same praise for those confident children, you find that a child who is so confident, because they have been having that approval from home setup, they carry that confidence towards them and even the workplace. So this can also explain the disparities that we have with people, where one person is very confident, another person is very unconfident. It is all because of what type of environment you have been brought up. Anxiety, as she said, can be genetic. There are people who are just born predisposed to it. You're just anxious because you have also unconsciously, your parents were very anxious growing up, and you tried and tapped into that. So even you as a child, you think it's the normalcy of life. It's just something. But when you go to an environment that now teaches you to relax, to meditate on positive things, and to recreate the environments that you want to see in your life, then now you start changing that. So environment is very critical, and I think it plays a major role when now we come to how calm or how anxious.
Yes. You've mentioned something about the workplace.
Yes.
The workplace that we are, considering she has also explained how family system can make us to be today. Can the work environment change an adult?
Absolutely. I don't know. Yes, it will change you.
Yes.
I'll give you a very, very good scenario, personal experience. I'm in a group of people that we work with, and every time we go for meetings, it's about how badly we performed last time.
Yes.
And instead of us planning how next we better ourselves, we can dwell on ours discussing how bad we were. So even next time, when we go now to do something else, all we'll be praying in our heads was like, we were told last time we did not do this. They want to get that excellent thing. So what happens in your production? You just mess everything automatically. Or sometimes even you don't try.
Yeah.
Because no matter how
or
much...
even you're afraid of.
Yes, because now you're already anxious. You're already afraid as to what repercussion or what outcome will I get. Because there has never been a moment someone has ever applauded you and said, that was good. There's always that creation of tension, fear, unknown fear. So even when I'm going to perform that duty, there's that unknown fear that I'm going to mess it up. So the environment that you create for your employees at work determines how good they perform.
Yes.
If it is this environment whereby everybody is in pressure, if the boss walks in and they know he's going to start quarreling and he knows he's going to start saying you did not do this, you get some people, even when the boss gets in, papers will start falling, others will start tripping, because already he's a sense of anger and anxiety. You don't know what's coming next.
You defend.
Already there's that fight and defense mechanism now, because now already your mind is like thinking, what is going to happen? The next thing I'm holding a glass, I'm starting to shake. What is he going to say next? Already his presence is making me anxious. But we have this boss who comes in and is a cartoon and, hi, how are you doing? How was your day? He makes fun about everything. You just set people into a relaxed mode. You become this person people can approach, people can talk to clearly. And even when you speak your mind, you know that you'll be heard. Nobody's going to reprimand you because you spoke your mind. So the way it determines with how you create that environment. Because sincerely speaking, it's all about creating an environment. We said it does not work in a vacuum. Assuming we come here and there's nobody in this studio, there's no environment. You are just the only person who is going to create the environment that you need. So even in workplace, we choose what kind of environment we want to create for our employees. And even as people who are working with each other, we choose the kind of environment we want to create with our co-workers. If you want to be seen as this unapproachable person, that is what you become. If you want to be seen as this approachable person, that is what you become. So even in workplace, you choose what kind of environment you create.
Mercy Wambua, Mercy Kibe said, we choose. I'm sure somebody listening to you is a boss, has juniors under him or her. And now there are also those juniors. You are also speaking to them. What would you tell them? Because she said you choose. Sometimes things just happen. What is that boss supposed to hear from you today on creating anxiety? And maybe tomorrow that person will be a better person.
Just like with any relationship, that's a work relationship.
Yes.
Just like with any relationship, communication is key. I'm pretty sure because of the order in which things happen in a company, there has to be someone that is either employee relation, HR, you know, or there's a link between you as the employee and your employer. It would just be important to say, and you see, it's also how you package the message. You don't go to your boss and say, no, by the way you come shouting in the office gives us anxiety. And then he will tell you, step out of my office. Because I mean, who's at the loss, you know? It's also just like in a romantic relationship, don't go telling your partner, but they don't like the way you shout at me. You know, it's like how you package the message. So find systems in which you can use. If it's having a meeting, having a representative, there's always a team lead, you know, someone who can take your complaint, you know. And it's not saying we do not like how we do this, just like we'd prefer if maybe the way the boss also packages, you know, the way they say, like, I would appreciate if you did ABCD instead of this and that, because we are getting more losses than gains. It's just how you communicate with each other. And like you realize at work, customer or employee satisfaction is directly related to how they perform. So you do not expect that you make them anxious and they're gonna do better. Like she's saying, you walk into the office and people are just scattering, you know. People are going to the toilet, they did not need to go to the toilet. Papers are just dropping in the office, they did not need to be falling. So it's just about creating an environment as a boss, but then also the employees know where the shoe fits, where it pinches. So you're the ones to also communicate and say, we'd like ABCD. And you see, I think it's just the whole idea of fearing power, where you assume that your bosses are not human beings. But if you approach them and say this, because also if you keep quiet, they think that this is how we do it. Pressure equals, you know, performance and achieving goals. But you realize there are some careers that experience this more, like people in tech, audit. There's some careers that have a lot of pressure in that. So because some of these careers come like that, it's important as an individual to find it in you and to find techniques that you can use for yourself just to help you with calming down. For instance, the most basic, having a routine. You know, you realize that when you procrastinate, it equals to more anxiety. You had a job to do at 8, it's 8:15. Now your manager is calling you and you're just feeling very anxious. So have a routine. Just decide, okay, fine, I wake up at this time and be consistent with it. Have a plan. Break down your major tasks into smaller ones. You know how our brains work. It's funny. When you have something really big to do, you just think, hey, I'd rather just not do it. But then once you break it down, you realize, hey, I finished this simple task, I can do the next. That is just how our brains work. So then break down your major tasks into smaller ones to reduce that pressure. So as an individual, as an employee, there's something you can do for yourself, but then also communicate when the work environment is not favoring you.
Wow, that is so wonderful. If I may ask, Mercy, in the hospital sometimes you find people with asthmatic attack, heart attack, and so many attacks. Do we have anxiety attacks?
Yes, we do. Yeah, we do have anxiety attacks.
How do they come in, and how can you say this is an anxiety attack and not asthmatic attack? I remember she said there are other symptoms, not just the mind. This person could be panting, like even breathing like asthmatic attack. As a psychologist, how would you tell me that, Lucy, this for sure, what we are dealing with is a anxiety attack?
I'll give you a very practical example. Assuming I have a child, and I think she mentioned it when we were starting, and all of a sudden this child is complaining to me about a headache, stomachache, and then with time it progresses to diarrhea, and I'm thinking my child has some bacteria infection, or my child is coming down with amoeba, or whatever thing. As a parent, I'll start to think. And when I go to the doctor, we run all these tests in the laboratory, and everything comes out negative. So I'm frustrated at first. And I'm thinking, this hospital, the equipments are wrong. So I go again and I look for another doctor, and the tests come out back again negative. So the next question I should be asking myself is, what is happening to my child? You see, she talked about psychosomatic issues, symptoms. And this is now when stress and anxiety starts to manifest itself as illness that is not there. So much tension, fear, panic starts manifesting itself. I start diarrheaing, I start having a headache. If the school, like for instance for a child, if the school environment is not favorable to that child, Then now every time it's morning, I only realize every time it's morning, my child is when they are having these headaches, it's when they are having a diarrhea. Now that
it is very programmed.
Yes, there's like a routine in it. Then now I say, apana, this is not illness, this is just a panic attack. This is an anxiety attack. So the next question I should be asking myself, what is driving this child to get these panic attacks? Is the child being bullied? Is the environment in school not productive or creative or accommodative to them? Are the teachers not facilitating this child to become more accommodative and comfortable in that environment? The same case goes even for mothers and parents. A good example is a newborn, a new mother. As in, would I say a new mother or a first-time mother?
Yes,
it's a new mother.
time.
It's a new mother. It's a first-time mom. And now she has this tiny little bundle of joy. So excited, everybody is excited. And when we are there during the day, she's so calm.
Yes.
At night, she knows this little person is going to start screaming here and I'm all alone. And she starts getting anxious, she's dropping everything.
Yes.
You know, she cannot think, she's sweating, you know, and you're thinking, are you okay? No, yeah, I'm okay, but it is experience that is awaiting me alone that is making me go into these panic attacks. So yes, there are panic attacks. Just like there's an asthmatic attack, there is a panic attack.
Yes.
But usually with panic attacks, there are things that trigger one to go into those panic attacks. And also we talked about post-traumatic depression or stress.
Yes.
Especially even when someone like soldiers, they go through it a lot. When you find a soldier who has come from war and they have experienced all those killing, near-death experiences.
They
and
have
this
seen
person,
their colleagues go down.
Yes, they have seen their colleagues go down and they are like telling you, I was supposed to be in that troop that just died. And when this person comes back home at night, they have these nightmares and then they start coming out, throwing things, beating people, shouting and screaming. That is a panic attack. Why?
Yes.
Because there are things, there are thoughts that trigger them into this mode of panic attack. So panic attacks are there, but it depends in which scenario and what triggers them. They are very different and very individual, depending on the experience one is going through.
Yes.
Yes.
Wow, that is very educative.
Yes.
I know our viewers are really getting it and they were going to practice. You know, when we talk of anxiety, I only thought it is all about happiness. You're happy because you're number one in class, you've gotten an award, you have a new job, and that is anxiety. It makes you not eat, not sleep. But now, when we come to the nightmares that you're speaking about, why would one have nightmares because of something that happened during the day? When you go to sleep, you're supposed to rest. The mind is asleep. Is there any relationship between what happens during the day and the dreams that we dream? Because, you know, when you tell me that someone has nightmares because of a war that happened during the day, and your mind is asleep, you are resting. Mercy Wambua, is there any relationship?
Yeah, you know, the thing with dreams, our dreams come from our unconscious. So dreams are not, they're not just creations. They're things that we have most probably experienced, but not dealt with. So it's not just something that someone will go through during the day and then now they dream about it. It's something that's buried in the unconscious.
Yes.
And many of the things that we do, aside from dreams, many of the things that we do, our behaviors are influenced by the things in our unconscious. That's why someone will come and say, I do ABCD, but I do not understand where it's coming from.
Yes.
So with nightmares, just because they are dreams, so nightmares are basically, you know, our brains are very photographic, so images are stored. So with that, it's just a replication of something that traumatic that happened. So when you check into it, you realize it was a traumatic event that was not processed. So, and you know, with constant nightmares, because sometimes nightmares can, almost all of us here have experienced nightmares. It's not all the time. But if someone is constantly complaining or they wake up from their sleep screaming and all of that, then it's something that should be looked into, because nightmares are manifestations of post-traumatic stress. So like she's saying, veterans, they'll probably be dreaming about, they'll be seeing their colleagues who died, someone who's lost a loved one. Grief could also lead to nightmares. You constantly see this person, and it's just a reflection of something that was not resolved. So in as much as you say we need to sleep at night, sometimes our brains do not rest.
We don't sleep.
Yeah, they do not rest, and that's simply because of the constant buried stuff that we do not deal with. And so sometimes things happen and you think, it's a non-issue, but then it may not affect you today, it may not affect you tomorrow, but 5-10 years down the line, you're in hospital, you're telling the doctor, hey, I usually can't sleep, or when it's time to sleep, my heart starts beating. When it's time to sleep, I feel like my legs have gone numb. And so when you check into it, it's something that was buried in the unconscious that is simply just now trickling into your conscious. Now you're almost reliving the experience. Yeah.
Thank you so much, Mercy, for that. Viewer, this is GBS TV Africa. We are continuing on mental health issues, and we are talking about anxiety. I'm sure you are learning something that is going to help you, to help your children, to help your family. We are continuing this after the break. Welcome back, viewer. We are discussing about anxiety. It is a moment that we all experience every now and then. Now we are going to look at a few things on teenagers and children. I don't know if you've ever seen a child who is anxious. Today we are going to understand how does that child behave, how does that teenager behave, because we have them in house, we have them in schools, in our villages, in our cities, we have children and teenagers. To our guests, Mercy Kibe, children, very sensitive, there are people who call them small adults, because they have their brains, they have their mind, they have their heart. Do children become anxious? And how can we be able to tell this is anxiety?
Children become anxious. And I'll go back to primary socialization, the first environment, the first person that a child interacts with when they start growing up. This determines how that child becomes. As Swahili says, mtoto utazama kisogo cha mamake. So mostly what happens with children is they run from us.
Yes.
And a child can become, as you have said, they are little adults. They are not just little adults, they are little humans who start learning how to receive from what we give them, and they reciprocate back. For instance, before I just get to anxious, if every time a child asks you for something and you snap them back, I will not be surprised if the day you tell that child and that child snaps back at you. Because it's what you give, it's what you receive from them. So a child is this, they can be, that's why we say we need to protect children, because they can be a board of reception of emotions, feelings, and ideas that we give to them, or we bring them out. So on an occasion of a child who is anxious, it is very easy to note a child who is anxious. And I'll give a practical example of a mother who is not so friendly or not so motherly to a child, and every time a child, you see, children learn, especially 2 to 3 years, we call it terrible 2. And like now they'll be all over the table, sweeping everything. They'll be on your phone. They want to experiment what's it happening. They want to hit. They're drawing tantrums. And this is a very sensitive stage for a parent, because how you handle this child in this stage determines whether the tantrums become uncontrollable or you control the tantrums. And remember, it is up to you as an adult to determine how this child negotiates this stage. So the moment this child comes and does something that is wrong to you, because you know when you sweep off my glasses from the table,
Yes.
young man or young girl, you're making me go back to the shop, and then you pinch.
Yes.
The next thing, this child goes, and especially when it is a potting stage, they miss the potty, and the next thing you spank them. You are creating fear.
Yes.
And this fear now, with time, it becomes anxiety. Because every time this child wants to go to the toilet, there's that anxiety of being spanked, of being disciplined. Every time a child sees a glass, there's that anxiety of I'll be pinched.
Yes.
So every treatment or reward that you give a child at that stage, it will either be reciprocated, whether with, it will be a reward of either a discipline or a reward. So the more you discipline a child, which sometimes is unnecessary disciplining, can create a sense of anxiety in a child. So how you handle a child determines whether you get a child who is anxious. And also every time, you see, children, they are imagery people. They create so much images. A child may not necessarily know your name, but when they see you, depending on how they relate to you, they start clapping. You know, they want to come to you. They are very excited. But now, assuming we have a father who is violent, and every time he comes home, it is throwing punches to the mother, flipping the tables over, telling everybody get out. The next time that father gets in, the child hides behind the sofa set.
Yes.
That is anxiety. Because this child already has fear. What will happen next? So she connects, or he connects, that man, his entry, with chaos.
Yes.
So that is how we nurture anxiety or confidence in children. And the way, with children, how we know they are anxious is by just learning how they are behaving towards different scenarios and different people.
Yes.
Yes.
Wow. So children react. Children have a heart.
It's true.
Because many people think that children are just children. In fact, we cannot be able to describe them, because sometimes you see, I want to look at a baby, I don't know if I would call it a baby or a child of 5 years. And you keep telling them, for example, why are you answering that question? You are not Mercy. Then the other time, this child will ask somebody else, Umeitika, are you so and so? Because somebody else said it. And sometimes you hit them, forgetting that those are the words you use on them. So sometimes children cannot be understood by people. But I thank God, because you people are here to make the world to understand that children are not just children. They are grown-ups. Sometimes when we talk to teenagers, we also would like to know if they understand what is anxiety. Mercy, when you talk to teenagers and adolescents, how can you tell that this is anxiety? Because now they are at an advanced stage. They are not like children. At least for children, you could understand it because of their age. What about teenagers and adolescents?
You know, teenagehood is a very delicate stage.
Yes.
Because this teenagers do not want to be treated as children, and parents do not want to treat teenagers as adults. So it can be a very confusing stage in life.
Conflict.
Yes. Simply because of the biological changes happening in their bodies that they do not understand. And just the need for autonomy. You know, they want to be independent, but they are not. You see, with teenagers, their frontal lobe is not fully developed, which you use to make decisions. That's why teenagers act on their emotions. You know, you don't expect that a teenager will understand action and consequence. It's basically, does this make me feel good right now? Can I drive at 180 kilometers on my dad's car? Does it give me, you know, does it give me thrill? That's how teenagers function. And so sometimes when you're being, like she's saying, even with teenagers, you can't also be too hard on them. Because sometimes you're also confusing them. You're telling them you're a grown-up, behave like a mature person, but at times also you're making decisions for them, which makes them feel like they're still children.
Yes.
So it can be a very delicate stage of life, but just like with even a child, a teenager will also just display anxiety in almost similar ways. It could show up as they constantly do not want to do stuff, they do not want to be seen or to go out. I'll speak of one change, like acne. Acne is very prone during teenagehood, and so because of that, you find that they become very withdrawn. They do not want to go out and play with or to go to parties if their friends are going to parties. They do not want to be with their friends. And that's simply because they're feeling like it's that fear of someone is going to point out and say, and Lucy, by what's happening to your face? Kwani, were you experimenting? Were you trying to bleach yourself, And so just that, the being withdrawn, and then also exam period, class 8 and also high school for teenagers, So you may realize that all of a sudden there's hysteria in school when it's almost KCPE, KCSE. Or now they do not want, everyone is at the nurse, oh, stomach ache, my head is aching. So it's not very different. It's just, for them it may be a little bit more advanced, because with children, how they communicate is tantrums. They'll just decide, the child is just mad and they pick things and they're throwing them, left, right, and center. And so it's almost just the same thing. It's just because now for teenagers it may be a bit more advanced, and then for adults it may be even more. And then also you may realize a drop in performance in school because of the anxiety. They're constantly worrying, they're constantly stressed. Or you find that children who are not top performers in class, and the teacher is constantly putting them on the spot. So it's almost like, come and do this sum on the board, and they're just like, because last time I didn't get it right, I was humiliated. So now they can't even hold the chalk nicely to write, There's trembling. You find that constantly, because teachers are saying your English is horrible, even when it's time to read a set book in class, they're shaky, they're very shaky. So there are many things that you can pick from teenagers, something that is outside their normal behavior, something that they wouldn't do on a regular basis. Like if this teenager was very outgoing, all of a sudden they just want to stay at home. They don't have friends, they do not want to be out with people. So any changes in behavior could be indicative of anxiety or even depression.
Yes.
Yeah. And also with teenagers, let me just add, because she was making my mind go all over teenagers. And I'm thinking also sometimes even displaying of overconfidence can be anxiety in itself.
Yes.
Whereby you find someone who is just over hyper, over trying to know that I got this together or everything. It's just a way of displaying anxiety in a different manner, because you don't know how to balance when you want to be you and what the expectations are for other people. So in a place where you're playing this overconfident, overexcited person can also be a sign that you're being anxious. So don't confuse it when parents see their child being overly everywhere. Don't confuse it for that child being outgoing. Yes, sometimes they can be outgoing, but it can also be anxiety being displayed in a different way.
Yes.
Yeah, so that's why she's saying with teenagers it's a bit confusing, because they'll display all these emotions and play laws that can just confuse you, and that's why we are not even understanding them right now. Yes, because it is all over the present. We are trying to pin it down, what is really happening with these people.
Yeah. Mercy, I know you, in your organization, you work a lot with girls.
Yes.
And there's this common condition, she mentioned it, hysteria. Is it a form of anxiety? And what do you usually tell girls? Because I know there must be girls listening to you. Hysteria, is it a form of anxiety?
Hysteria is a form of anxiety.
Yes.
As she said, this is a stage whereby there are all these emotions. The teenager is discovering themselves. They want to be adults. Then again, they want to be a child. They want to be baby. They want to be left alone.
Yes.
So, and especially in girls' schools, before I just touch on hysteria, before we even become to hysteria, it is sad when I talk to majority of these girls, I even don't think they're suffering from hysteria anymore. It's about how active we are sexually, these girls. And it baffles me at times.
Yes.
Because I'm wondering, why are you rushing to this? Because now what is happening is, I don't know why there is that conflict of girls wanting to be all over the place and wanting to jump before the drums, if I may say it. But when it comes to hysteria in girls nowadays, I don't think it's something that's really affecting them nowadays, because they are having outlets, so many outlets within their environment. And even when that hysteria is being displayed, it is not something that you can just pinpoint and say this is hysteria or anything. It is becoming, form of chaos. In schools, you go to schools and you find girls are bullying each other. You go to schools and you find girls have family issues, which are creating anxiety in them, such that even when they are trying to study, and a child will tell you, every time I go and start revising and I'm thinking what's happening back at home, I cannot start performing again. So the question is, what environment are we creating for our children? Even before we come to this hysteria, what environment are we creating back at home for our children? And then when we come and dump them in schools, because it's like we are dumping them in schools, and we expect the teachers to have them all in control. The same teachers who have so much pressure from the ministry to perform. Now here becomes a conflict of two people under pressure. The teachers are under pressure to perform. The pupils are anxious and emotionally confused because of what they have been happening to school. Remember, there's no time now for these teachers to bond appropriately with the pupils. So when you push this child to reach the maximum because you want them to cover the syllabus, they feel the teacher is not paying attention to the emotions and they are feeling and not understanding where they are coming from. So what happens is there is a conflict of interest, there is no understanding, and the next thing you hear, kids are burning schools, kids are running away from school, kids are pregnant, kids are everything, and you wonder what happened. Where did we get it all messed up in this school environment? So even hysteria now becomes a form of expressing all these mixed emotions, fatigue, anxiety, because one moment a child is home, 2 weeks, 3 weeks, they are back again. Even that anxiety of, where am I going back to that environment again, where I come from? And then I've just come here, and then again you want me to go back there. There's so much conflict in how we are dealing with our teenagers right now. And you cannot really be saying that hysteria is part of anxiety. It can also be part of pressure. It can also be brought about by the pressure they are going through. It can also be brought about by mixed emotions that they are not understanding where they are coming from. So we really need not just say it's because of anxiety. Can we just pinpoint the main root of what is leading them to that?
Yes. Many parents have a problem in understanding the adolescent and teenage age because of the controversy of one thing versus the other. Mercy, do you have a word for the parents in terms of dealing with anxiety? Because you began by telling us that excess of it brings a disorder, which will land somebody in a mental health institution.
Parenting, I always joke around and say that parenting doesn't come with a manual. So anyone who's parented knows how difficult it is. But just the way, I think it's the whole issue of fear as a parent, because you realize no one got to where they are as an adult without passing through adolescence. And so you're trying to imagine if things were happening like that in my time, and the way now children are exposed right now, it must be even more difficult for them. But just the way you're patient when a baby is learning how to crawl and then stand and walk while holding things, and then now eventually be able to walk by themselves, it's the same thing you do with teenagers. Now the thing is balance. Don't baby them, and also don't be too hard on them. Be friends with them, but also do not let them know that you're still a parent, but you have formed trust with them that they can tell you things. The thing with teenagers that they feel, you hear this with many teenagers, oh, my parents do not understand me, my teachers do not understand me. It's basically because they feel like you don't get that they're in a state where first they do not understand the things that are happening in their bodies, and then there's also the issue of their developing feelings, like you're saying, they're very sexually active early nowadays, so they do not know what to do with those things. It's just in your family, you're like, or in your house, you're like, I do not want to see boys in my house. If you're a girl, I do not want to see girls. But then what are you telling this teenager, what do they do with what they're feeling? It's just letting them know that imagine this is not a permanent stage. You'll be a teenager until you're 18, 19, and then it will be done. Of course, by that time, your brain is still not fully developed until you're 24, but you realize it's not you'll not be in high school forever, you'll not be in primary school forever. So just letting them know that it's okay that they are going through the things that they are going through, but it doesn't mean that it's an excuse also for them to behave in very erratic ways. So just be patient as a parent, because you also were a teenager and someone probably was really hard on you, and if you're not careful, some of the mistakes you made as an adult or in that period was because of someone being very hard on you. So if you're also very hard on this teenager, what do you expect them to do? They will rebel. And so it's just finding balance. Don't baby them, don't be too hard on them. Be friends with them, but then also don't be too close with them, so they also lose that respect for you as a parent.
Wow.
Yes.
Viewer, we were discussing about anxiety, and as we come to the end, I would like Mercy Kibe, face your camera, say your parting shot to the viewer and remind them where they can get you.
Thank you so much, Lucy. My parting shot will be based on teenagers. There's this generation gap that we are going through right now. How we were brought up is very different from how we are bringing up children right now. So I think for me, to any parent who is who is bringing up a teenager right now, it's good to understand that times have changed, and instead of us being anxious and panicking every time our teenagers do something, it would be more important if we sat them down and listened to what they have to say, so that then we can be able to form a solution from there, other than imposing our solutions onto them. My name is Mercy Kibe. You can find me at Hazina Towers, Kenya Institute of Professional Counselors, or you can follow me on Facebook at the Phoenix Hub, and we interact more there. Thank you so much.
Thank you so much, Mercy. Mercy Wambua, your parting shot?
What I'd say is, just to wrap it up, is that you're not alone. Whatever you're going through, you're not alone. And just to reiterate, parents create environments, employers create good environments. And if you're feeling like you're at a space where it's almost like your mental health is not anything that you can control, it would be important to seek professional help. So I am Mercy Wambua, and I'm really glad to be here. You can call me on 0714-243-097. I'll say that again, it's 0714-243-097. Thank you.
Thank you so much to our guests. We were discussing about anxiety. All I can say for today, don't stay alone, speak up, and we are going to help you. I was your host, Lucy Wanza Kariuki. Bye-bye.